Sandali anak, sandali, sandali. Okay, so good morning again, everybody, and welcome to our second day of SDCA Nurses and Caregivers Week 2020. And for today's activities, we have our nursing quiz bee, followed by our Simbo Kahoot. And while waiting for our participants for today's event, um, we will just tell you guys what are the other activities that we have for this day. So after our virtual Simbo, we will be having in the afternoon our TikTok challenge 1 and 2 and our Dear Ate Florence, Sampung Tula para kay Ate Florence, and e-game semi-finals. So I hope you guys will just stay tuned and wait for our games for this morning. So thank you. All right, good morning once again, and welcome back on our second day of SDCA Nurses and Caregivers Week. So now we're going to start our quiz B, which is named as Battle of the Theories, and we have five teams right here. We have the team Dorothea Orem, headed by Professor Christian Tu. We have our Callista Roy, headed by Professor Rosel Gutierrez, our Madeleine Linenger team, which is headed by Professor Marinette Dupaya, our Jean Watson team, headed by Professor Serena Joy Alarca, and last is our Hildegard Peplao team, which is headed by our Professor Eveline Tadena. So let me read first the mechanics of the game. So the quiz bee consists of three levels. The easy round consists of 10 questions, which are equivalent to 1,000 points for every item. And we also have the medium round, consists of 10 questions as well, which are equivalent to 1,000 points for every item. We also have the difficult round consists of 10 questions as well, which are equivalent to 2,000 points for every item. So in every level and item, there is a corresponding time limit given to avoid cheating and refer to the guidelines of course, for the pointing system in each round. So winners will be determined at the end of the activity. So failure to follow the guidelines, mechanics, and rules will automatically be subjected for disqualification. All right, so I think we are about to start right now. So, okay. Okay, I think we just encountered some technical difficulties. Um, all right, we will start again with our quiz B for the Battle of Theories. So for our team, we have Dorothea Orem, which is led by Professor Christian Tu, Callista Roy, headed by Professor Rosel Gutierrez. For Madeline Lininger team, we have Professor Marinette Dupaya. For Jean Watson team, we have Professor Serena Joy Alarca. And for the Hildegard Peplao team, we have Professor Evelyn Tedena. So, again, for the mechanics of our quiz B, quiz B consists of three levels. So the easy round consists of 10 questions, which are equivalent to 1,000 points for every item. And the medium round consists of 10 questions as well, equivalent for 1,000 points for every item. And the difficult round consists of 10 questions, which are equivalent for 2,000 points as well for every item. So in every level and item, there is a corresponding time limit given to avoid cheating, and winners will be determined at the end of the activity. So, failure to follow the guidelines, mechanics, and the rules will automatically be subject for disqualifications. So, I think we are all ready to start our um, nursing battle of theories for today. All right, so go ahead. Let's start now. So, for our host today, we have Professor Ronald C. Tuminis as our facilitator for our Quiz B Nursing Theories Battle. Thank you.
Good morning. So we're going to start now with our question number. The question number one previously was already bonus. So every group will get points for that particular question. So we will move to question number two. Ready, team. Oops. Okay, I think there is a technical problem with the team RM, so we will just wait for them to get back in the game. Okay. So again, the easy round, we will now go with the easy round, then followed by the moderate and difficult round. Hmm. Okay, so while we're waiting for the Team RM, Team Watson is here, Team Peplau, Team Leninger, Team Roy are all here. We're just waiting for the Team RM to come back in the game. There you go. The Team RM is already in the game, so we can start now. Question number 2. Okay, we're still in the easy round. So that is the question number 1. If a male client experienced damage in the hypothalamus, the nurse would anticipate that the clients have problems with A. Body temperature control, okay, visual acuity, balance and equilibrium, or thinking and reasoning. This was already been answered. Okay, so the answer is body temperature. Since our since the hypothalamus controls the act as your center thermoregulation. Okay, so everybody, that is already considered bonus point to everybody. So this will now be the test for the easy round. Question number 2. The position for suctioning for a conscious client. Fowlers, side lying, supine, or prone. You can now start answering now. You have 35 seconds. 25 seconds. 15 seconds. You have 10, 9, 8, 7, 6, 5, 4. Okay, there you have it, guys. So let's see who got okay. So everybody got the correct answer except, hmm, let's see. Okay, so there, okay, Team Roy, okay, is the leading group, followed by Team Peplau, Team Leninger, Team Watson, and Team Orem. Okay, so the leading group is Team Roy. So let's go to the next. Number 3. Communication is a vital role in a nurse-patient relationship. To be able to have a harmonious relationship with one another, the nurse should know what are the main purposes of communication. Is it to obtain information and influence others, to guide, to avoid confusion, or to help? And now start answering now. Okay, there are already 3 answers. We're just waiting for 2 answers from the 2 groups. Okay, 3, 2, 1. Okay. So the answer is to obtain information and influence others. Let's see who got the correct answer. Oops. Number four, what are the components of communication? Is it sender, receiver, message, feedback channel, encoder, decoder, message, feedback channel, sender, receiver, message, feedback, silence, encoder, decoder, message, feedback, review? Gonna start answering now. So there's already one group who answered, two groups. We're still waiting for three groups to answer. Okay. So, oops, two groups got the correct answer. Up again, still. Wow, leading the Team Peplau with 3,000. Team Roy, Team Watson, Team Leninger, and Team Orem. Oh, Team Orem, you can do it. Let's go to the next question. In Maslow's hierarchy of physiologic needs, the human needs highest priority. A. Okay, we have love, elimination, nutrition, or oxygen. Okay, there's already one group who answered the question. We're still waiting for the four groups. Go, go, go. We're still waiting for two groups. 10 seconds. Okay, so the answer is oxygen is the highest priority in Maslow's hierarchy of needs. Refer, okay. So let's go to the next question. The optimum level of functioning of individuals, families, and communities is greatly affected by the ecosystem. The increase of crimes and lack of safety in streets is an example of which factor that affects optimum level of functioning. Is it behavioral, heredity, political, or healthcare delivery system? Okay, still have 20 seconds. There's already one group who answered the question. We're still waiting for the other groups to answer. 10 seconds left. Two groups answered. Okay, so the answer is for this question political aspect or factor that affects your optimum level of functioning. Congratulations, who got the correct answer. Let's see the ranking. Okay, so still Team Peplao is our top group. We have Team Roy followed by Team Roy, followed by Team Watson, then Leninger and Orem. Okay, let's move to the next question. The epicardium is also known as parietal pericardium, is a layer of cardiac muscle. Is it visceral pericardium or is the pacemaker of the heart? You can now start answering the question. The epicardium, is it known as a parietal pericardium, is a layer of cardiac muscle, visceral pericardium, or the pacemaker of the heart. One group answered. 16 seconds left. Okay, so the final score will be tallied later. So this the score that you are can see right now is not the final score because the team RM is having some difficulties, but they were able to answer the question. So we will just finalize the score later. Okay. So to give chance for the team RM, we will not show for a while the scores because the team RM is having some technical difficulties in terms of posting their answer. The answer for this particular question is the epicardium is the visceral pericardium. Okay, not the parietal pericardium. Okay, congratulations, you got the correct answer. Let's move to the next question. Okay, let's just skip that since the team RM is having a delay in the posting their answer. Thank you. Let's move to the next question. The blank system synthesizes vitamin D. The blank system synthesizes vitamin D. Is it integumentary system? Is it the organ system? Is it the tissue or skeletal system? You can now start answering the question. Okay, there are already two groups who answered the question. Okay, the answer is, of course, integumentary system, the one that synthesizes vitamin D. Okay, next question. Which of these structures is not found in the mediastinum? Is it the esophagus? Is it the heart, lungs, or thymus gland? Which of the structures is not found in the mediastinum? Is it the esophagus, the heart, the lungs, or the thymus gland? Okay, there's already one group who answered the question. Okay, the answer is lungs. Okay, the esophagus, heart, thymus, and trachea are found in the mediastinum. The lungs are not found in the mediastinum. Congratulations, you got the correct answer. Okay. Mukhang maganda mga laban ngayon. And the last question for the easy round. The nurses observes that Mr. Adams begins to have increased difficulty breathing. Okay. The nurse elevates the head of the bed to the high Fowler's position, which decreases his respiratory distress. The nurse documents this breathing as what? tachypnea, eupnea, orthopnea, or hyperventilation? You can now start answering the question. Still have 10 seconds to answer. Okay, the answer is orthopnea. Orthopnea is difficulty of breathing, except in the upright position. Tachypnea is rapid respiration, characterized by quick, shallow breaths. Eupnea is normal respiration, characterized by quiet, rhythmic, and without effort. Okay, so we have it for the easy round. Sino kaya ang mga nangunguna? Okay, so we have the Team Leningers the third, Team Roy, and we have Team Peplao. Okay, they got 8 out of 10. The Team Roy got 5 out of 10. The Team Leninger got 5 out of 10. So the RM will be count manually. Okay, so let's see the final scores. Okay, since the Team RM is having some technical difficulties, but of course, okay, we will wait for them. So just for announcement again that we are having our ongoing nursing quiz bee, Battle of the Theorists, followed by virtual simulator. Then we will have a TikTok challenge 1 and 2. And of course, we have Beer at the Florence. This is a quarantine diaries. Okay, that student experience during the quarantine days. We have also Sampung Tula para kay Florence. This is a poem writing. And later this afternoon, we will have the semifinals for e-games, the mobile games. Bang, bang, bang. Okay. So we do not know who will be slain for today or during the semifinals. Okay, so they're just tallying all the scores for the easy round. So we are now on our day 2 of our Nurses and Caregivers Week 2020. So for the moderate round, so we have again 10 questions that will be given to our group. Okay, so cheer, cheer, cheer sa mga team natin. Let's cheer for our team. Okay, I hope that team members are here. Let me see. Oh, go, go, go team. Madeline Nellinger from Nicanilias. Go team Calisteroy. Okay, we have here from Nicole Malazarte. Go Orem. Okay, from Josel Panganiban. Go Team Leninger. Okay. You have guys lots of support from your members. Team Peplao all the way. Wow, from Mr. Dizan, from Christian 2, Calista Roy, go, go, go. Go Team Peplao from Miss Lelanas. Okay, go, 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 all team from Velasquez, Rujonel. Okay. You can send your message here if you want to shout out for somebody. Go Kalista kung ayaw nyo mabash. That's from Sir 2. Okay, Kalista I think is the lowest score. Just kidding. Okay, go Team Kalista Roy. Go Kalista from Miss Kim Pilago. Okay, we have also Go Ore from April. Yeah, from their leader, April and Carnado. Okay, so I think, okay, easy round is like a warm-up game for everybody. Shout out po kay Henry Olaes and Ralph Cruzen from Mr. Quero. Eliza Abergonzado, go! Jane Watson. Okay, don't forget to cheer for your group. Let's go, Watson. From Frederick Sanchez. Okay, from Navarro Abigail, shout out po kay Josel Panganiban. Kim Pliago, Pogi Serron, Sip Sip. Team from Tita Benobra, go go go, Team Teplao. From Rojonel Velasquez, shout out po sa ex kong nang iwan. Oh my. Haha. That's okay. Let's go, Team Teplao. Okay, natawa ako doon. So we're still now, okay, waiting for the next round, which is the moderate round. Okay, and I think, okay, all the team are already complete and testing your tech. Tech check. Okay, and everybody's here, so we can start now with the moderate round. Let's do it. Good luck, guys. Question. Alcoholics and drug dependents commonly uses this defense mechanism for forget painful experiences. Alcoholics and drug dependents commonly uses this defense mechanism to forget painful experiences. Is it denial, repression, regression, or rationalization? Alcoholics and drug dependents commonly uses this defense mechanism to forget painful experiences. Is it denial, repression, regression, or rationalization? Still have, okay, few minutes left. One already gave their answer. One group, okay, gave their answer. Okay, two groups already answered. You have less than 20 seconds to answer the question. Okay, time's up. The answer is repression. Okay, the answer is repression. Okay, I hope that everybody got the correct answer. But it seems it's not. Okay, so let's move to the next question. Okay, question number 2. The four main concepts common to nursing that appear in each of the current conceptual models are person, nursing, environment, medicine, person, health, nursing, support systems, person, health, psychology, nursing, or is it person, environment, health, or teaching? Okay, one group answered the question very fast. Two groups. We're still in the moderate round. Good luck, team. You still have time to finalize your answer and think. Four main concepts common to nursing that appear in each of the current conceptual models. Okay. Okay, so the answer is person, environment, health, and nursing. So the four groups got it correct, and one went to person, health, nursing, support system. Okay, try it again. So there are four groups got it correct. Congratulations for the four groups. Okay, next question. Maureen, age 12, is brought to the clinic for evaluation for suspected eating disorder. To best assess the effects of role and relationship patterns on the child's nutritional intake, the nurse should ask, what activities do you engage in during the day? Or is it, do you like yourself physically? Or do you have any allergies to foods? Or what kinds of food do you like to eat? Can now start answering the question. Good luck, team. One team already answered the question. We're still waiting for four team. Okay, we're still waiting for four teams to answer the question. You still have less than 20 seconds left. Okay, two, one. Okay, time is up. Oops. So there are three. Okay. Mhm. Okay, so I think no one got the correct answer. So the answer is, do you like yourself physically? What is the rationale here? Role in relationship patterns focus on body image and body's relationship with others, which commonly interrelated with food intake. Questions about activities and food preferences elicit information about health promotion and health protection behaviors. Question about food allergies elicit information about health and illness patterns. So the answer is, do you like yourself physically? Because it talks about relationship with each others, which commonly interrelated with food, I mean, a body image and patient's relationship. Okay, so try. Okay, so you can try it next time. Teams, what happened to that question? Okay, didn't get it right, but that's okay. We still have plenty of questions. Okay, like we still have 7 questions left or 6 questions. Okay, so let's go to the next question. Mm-hmm. That's okay, Team RM. Yeah, will be finalized later. Okay, so fourth question, what is the landmark for inserting NGT to the client to ensure right length of the tube? Is it tip of the nose, earlobe, umbilicus? Is it xiphoid process, earlobe to tip of the nose? Is it tip of the nose to xiphoid process and to earlobe? Or is it in from the earlobe to xiphoid process to the tip of the nose? You can start answering the question. Okay, you have less than 30 seconds, and one team already answered. We're still waiting for the other teams to answer. So just announcement. So we will not announce the final score here. Okay, we still have to finalize all the answers. Okay, lesson 10. Okay. So the answer is xiphoid process to earlobe and to the tip of the nose. So only one group got it correct. Okay. Answer, but since at the team RM we will count it manually, so we do not know what is their answer. So for this particular aspect, so one only got the correct answer. Is it okay? The answer is xiphoid process, earlobe from the xiphoid process to the earlobe until to the tip of the nose. Okay, move on to the next question. Okay, moving on to fifth question, number 5, community health nursing as defined by Jacobson. Oh, so is it service rendered by professional nurse with communities, groups, families, and individuals at home, in health centers, in clinics, in schools, in workplace for promotion of health, prevention of illness, care of the sick at home, and rehabilitation? Or is it any activities performed by the nurse in accordance with the restoration and maintenance of health of an individual? Is it process of enabling people to increase control over and improve health? Or is it nursing practice in a wide variety of community services and consumers advocate areas and in roles at times including independent practice? Community Health Nursing by Jacobson. Hmm, moderate question. We're still in the moderate round. Okay, less than 10 seconds to finalize your answer. Okay, the answer is nursing practice. SAGE-N by Jacobson is a nursing practice in a wide variety of community services and consumer advocate areas and in roles at times including independent practice. The first one is in red, that is community health nursing by Ruth B. Freeman. Okay, and activities performed by a nurse, that is nursing by Blackwell. And process of enabling people to increase control over improve health, that is health promotion. Okay, so one got it correct. Okay, Let's move to the next question. Okay, next question, please. Okay, question number 6. A female child, age 6, is brought to the health clinic for a routine checkup. To assess a child's vision, the nurse should ask, do you have any problems seeing different colors? Is it how are you doing in school? Do you have trouble seeing at night? Or do you have problems with glare? A female child age 6 is brought to the health clinic for a routine checkup. To assess a child's vision, the nurse should ask, do you have any problems seeing different colors? How are you doing in school? Do you have trouble seeing at night? Do you have problems with glare? Can I start answering the question? Good luck, teams. Please save your shout out in our chat box in the YouTube. Okay, less than 20 seconds. 10, 9, 8, 7, 6, 1. Time is up. The answer is, how are you doing in school? The rationale is a child's poor progress in school may indicate a visual disturbance. The other options are more appropriate questions to ask when assessing vision in a geriatric patient. Okay, I hope the rationale is clear to you guys that the rest of the choices are question assessing vision in a geriatric patient, not for this particular client who is a 6-year old. Okay, so that's for question number 6. Let's move to question number 7. Okay. A mother asked the nurse how to handle her 5-year-old child who recently started wetting the pants after being completely toilet trained. The child just started attending nursery school 2 days a week. Which principle should guide the nurse's response? Is it the parents may refer less mature behaviors? Is it the child returns to a level of behavior that increases the sense of security? The child forgets previously learned skills? Or the last choice, the child experiences growth while regressing, regrouping, and then progressing? You can now start answering the question. A mother asked the nurse how to handle her 5-year-old child who recently started wetting the pants after being completely toilet trained. The child just started attending nursery school. Which principle should guide the nurse's response? The parents may refer less mature behaviors. The child returns to a level of behavior that increases the sense of security. The child forgets previously learned skills. Or the child experiences growth while regressing, regrouping, and then progressing. 7 seconds. 1, 0. Okay. So the answer is the child returns to a level of behavior that increases sense of security. What is the rationale behind the stress of starting nursery school may trigger a return to a level of successful behavior from earlier stages of development. A child's skills remain intact, although increased stress may prevent the child from using the skills. Growth occurs when the child does not regress. Parents rarely desire less mature behaviors. Okay, I think no one got the correct. Okay, so let's move to the next question. Question number 8. Okay, blood transfusion is important, essential nursing and medical procedure, but can be very fatal, life-threatening if administered incorrectly. Monkey D. Luffy is about to undergo blood transfusion because of severe anemia. His hematology test reveals the following: hemoglobin of 8 grams per deciliter, hematocrit of 29%, RBC of 2.8 million cells per cum. The patient is very weak and pale. The blood type of Laffy is A. Which of the following blood may he receive? The question here is, which of the following blood may he receive? Is it O, AB, B, or any of this? Which of the following blood may he receive? Is it O, B, AB, or any of this? The answer is type O as the universal donor. Oh, two teams got it correct. Okay, so that's it for question number 8. Let's move to question number 9. The unique function of the nurse is to assist the individual sick or well in the performance of those activities, contributing to health or its recovery or to peaceful death, that he would perform unaided if they had the necessary strength, will, or knowledge. I repeat the question. The unique function of the nurse is to assist the individual sick or well in the performance of those activities contributing to health or its recovery or to peaceful death, that he would perform unaided if they had the necessary strength, will, or knowledge. Is it Florence Nightingale, American Nurse Association, Lydia Benson, or Virginia Henderson? The unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery or to peaceful death, that he would perform unaided if they had the necessary strength, will, or knowledge. That's question number 9. Time is up. Very good. Okay. So the answer is Virginia Henderson. Okay, so don't worry, guys. Even there are only 3 group has been posted here. Doesn't mean that the 2 groups, okay, didn't get it right. So we will just tally this, okay, later. So that's question number 9. Last question for the moderate round. Public health is a core element of government's attempts to improve and to promote the health and welfare of their citizens. WHO defined public health as what? Science and art of preventing disease, prolonging life, promoting health and efficiency through organized community effort. Is it art of applying science in the context of politics so as to reduce inequalities in health while ensuring the best health for the greatest number? Is it ensuring the health of every working person in the country are safe and in healthful work condition? Or is it the practice of nursing in the local, national health departments where nursing skills are applied? You have less than 20 seconds, and there are two groups already answered the question. Okay, already three and four groups. Maybe the last group already answered it. Okay, WHO defined public health as. Okay, there is a correction here. It should be art of applying science in the context of politics so as to reduce inequalities in health and ensuring the best health for the greatest numbers. So that should be the answer. The science and art of preventing disease, prolonging life, promoting health and efficiency through organized community effort is public health by Watson. Oh, sorry, by Jacobson, I mean. Okay. Okay, so that's it for the moderate round. Okay, so but this is guys, okay, reminder again, this is not the final, okay, final tally of score, but Team Roy, okay, let's see. Okay, so they are just okay. We will have a bit pause for a while, like 2 minutes, while they are finalizing all the answers of our team. Okay, so let's go back with our YouTube channel from the SSA Nursing Student Council. So don't forget to like and subscribe. Okay, down. So we only have 64 likes. So can you please click, 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 click? Okay, from Mr. Gaba, Team Roy. Okay, Josel Panginiban. Go, 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 Team Roy. Nisagid, Melgin, heart, heart, heart. So guys, don't forget to like and subscribe in our channel. Let's go Team Leninger from Miss Nelias. Team Roy, go, go, go from Professor 2. Me, it seems that really Sir 2 wants to become the overall champion for this year's Nurses Week and Caregivers Week. Okay. Oh, Mr. Basura, Team Roy, hehehe. What team invite that? Hehehe. Okay, from Ma'am Tita, Team Madeline, go, go, go. Okay, from Miss Sensontic, galing, Peplao. Eliza Abergonzado, go, go, go. Jean Watson. Okay, Sir 2, dapat alam mo na, Sir Ron. Okay. Miss Nilias, let's go. Team Leninger. Miss Sena, go. Team Caliceroy, Sir 2 lang malakas. Go Sir 2 from Caber. Gutierrez, Team Leninger. Okay, Kim Plelago, go Team Roy, go Team Roy. Miss Danica Ilang-Ilang, go Lucky. Oh, pogi naman ng host from Miss Nell, yes, of course. Exit from Sir 2, ha ha ha, champion, alam ng team ko ang premyo. Oh, so Sir 2 will give you big surprise. Okay, go Team Mercury from Mr. Cruz. Okay. So there are lots. I cannot read it anymore because there are lots of students. Wow. You are really cheering for your group. Okay. Mabawi Team Watson from Lucky Castillo. From Charlie Mukite, pengi sa akin ni Kusyon. What's that?
Okay, from Panopio, go Team Peplao. Dayan Sanchez, Team Orem, heart, heart, heart. From Miss Resoso, go Peplao babies. Wow. Team Pelage, push lang. Team Roy. Gabriel Panteras, go Lucky. Go Peplao babies, heart, heart, heart. From Miss Resoso, from your team leader. From Gabriel Panteras, Lucky ang pogi mo. From Miss Malazarte, laban mga ka-orem. From Miss Olantige, thank you NSC kahit walang tulog. Ha ha ha. From Miss Subiaga, go Team Calista Roy. From Sir Lavarn, Team Calista. From Nika, CG Batch 107, heart, heart, heart. Go Sir Ron, heart, heart, heart. From Miss Sanchez. From Miss Panopio, go Team Peplao. From Ma'am Rosel, di papatalo ang Leninger. Go, go, go. Ha, 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 ha. Okay, go Team Peplao. Let's go third year from Miss Nelias. Okay. Laban din. Team Orem, kaya natin yan. From Professor 2. Lavern lang. Okay, drop your message here. Any shout out, guys? Okay, Ma'am Rosel, Sir Ron the best. Miss Subiaga, go Team Calista Roy. Miss Ilang Ilang, go Watson, proud of you guys. CG107, go, go, go. From Miss Malazarte, Sir Ron, pa-shoutout ng 4th year lang malakas. From Ma'am Gutierrez, shout out to all the nursing faculty. Woo! Okay, Momay Diaz, Diaz Normie, BSN 3. From Miss Velasquez, pag nanalo Team Watson, ibig sabihin nun, panalo sila. Go Team Watson. Watch out Team Watson. Shout out po sa lahat ng NSC. Hinga po ng malalim. From Miss Ilang Ilang, Watson Babies. From Ma'am Joy, good luck to all. Okay, Ilang Ilang, bawi tayo. From Miss Caber, pa-shout out kay Sir 2. Ma'am Tita Benaobra, shout out for BSN 3. Shout out daw po kay Sir 2 from Naisha TV. Parang mas masarap magawa nito Charlie Mokite, go Team Roy. From Miss Panopio, go Team Peplao. From Ma'am Rosel, Leninger, love, love, love. Oh, love. From Miss Guevara, go Leninger. Go Peplao Babies from Mr. Soso. Go Leninger from Miss Guevara. Go Junel Velasquez, wash out sa lahat ng nanood. Vlog, welcome to my guys. Danya Antoinette Guevara, go Team Leninger. From Maria Kathleen, sasayaw kami ng sayaw. Kikay, pag nanalo, Team Roy. Hahaha. Oh. Can't wait to see that. From Adora, shout out to Team Jean Watson. From Eileen Olantigue, sana all po, love. From Miss De La Isla, shout out Team Leninger. Okay, Martita, nice voice for the host. A shout out naman po. Shout out, Ma'am Tita. Buena obra. Mabisyo Basura, Team Roy. Hehe. Okay, so we are now going to the last round of our Battle of the Furies 2020. Hmm, let's see who will really get the 10 perfect score. Okay, so Team Roy, are you ready? Team RM, are you ready? Team Peplau, are you ready? How about Team Watson? Are you ready? And the last but not the least, Team Leninger, are you ready? I hope everybody's ready. Okay, Godspeed, good luck. This is the last round. Difficult round. Question number one. The correct sequence for assessing the abdomen is tympanic percussion, measurement of abdominal girth and inspection, assessment for distension, tenderness, and discoloration around umbilicus? Or is it percussion, palpation, and auscultation? Or is it auscultation, percussion, and palpation? Hmm, tricky question. The correct sequence for assessing the abdomen is tympanic percussion, measurement of abdominal girth and inspection, assessment for distension, tenderness, and discoloration around umbilicus, percussion, palpation, and auscultation, or is it auscultation, percussion, and palpation? There are already three groups answered the question. Still waiting for the two groups to answer. Good luck. Yeah. Mm, mm. Oh, yeah. Shout out kay Miss Olmo who made this Battle of the Theorist possible. And to our NSC headed by the president, Miss Erica de Guzman. Shout out, heart, heart, heart. Okay, so I think one left. Okay, so the answer is auscultation, percussion, and palpation. Okay, so there are four groups maybe. Okay, so we will just count the last group, okay, manually later. Okay, so congratulations. Next question. Question number two. Okay. Nurse Nagy is taking care of a 3-day-old neonate was delivered 36 weeks gestation. The nurse must know that the preterm is at risk of having ROP. Question. The other name for retinopathy of prematurity is retinal detachment, retrolental fibroplasias, partial retinal detachment, or D, or the last choice, none of this. Nurse Nagy is taking care of a 3-day-old neonate was delivered 36 weeks gestation. The nurse must know that the preterm is at risk of having ROP. And the other name for ROP or retinopathy of prematurity is retinal detachment, retrolental fibroplasias, partial retinal detachment, or none of this? If you listened very carefully during your time with Mom Alarka or with Mom Shirley Pasete, you will get this answer. You will be able to answer this confidently. Okay, so there are already three groups answered the question. Less than 10 seconds. Okay, the answer is retrolental fibroplasias. Whoa! So mga Ma'am Joy, Ma'am Alarka, and Ma'am Pasete, they really listened, okay, during your lectures with them. Congratulations, guys. You got it correct. All five groups. Question number 3. The physician orders a maintenance dose of 5,000 units of subcutaneous heparin, an anticoagulant, daily. Nursing responsibilities for Mrs. Mitchell now include: is it reviewing daily activated partial thromboplastin time, or the APTT, and prothrombin time, which is the PT? Reporting an APTT about 45 seconds to the physician. Assessing the patient for signs and symptoms of frank and occult bleeding, or all of this. The physician orders a maintenance dose of 5,000 units of subcutaneous heparin. It's an anticoagulant and it is being ordered daily. Nursing responsibilities for this patient include reviewing daily activated partial thromboplastin time, or the APTT, and prothrombin time, PT. Reporting an APTT above 45 seconds to the physician. Or is it assessing the patient for signs and symptoms of frank and occult bleeding, or all of this? Three groups already answered it. Okay, let's just wait for the others to answer. Tricky question. Less than 15 seconds to answer the question. The answer is all of this. Okay, why? Because all of the identified nursing responsibilities are pertinent when a patient is receiving heparin. The normal activated partial thromboplastin time is 16 to 25 seconds, and the normal prothrombin time is 12 to 15 seconds. These levels must remain within two and a half the normal levels. All patients receiving anticoagulant therapy must be observed for signs and symptoms of frank and occult bleeding, including hemorrhage, hypotension, tachycardia, tachypnea, restlessness, pallor, cold and clammy skin, thirst, and confusion. Blood pressure should be measured every 4 hours, and the patient should be instructed to report promptly any bleeding that occurs with toothbrushing, bowel movements, urination, or heavy prolonged menstruation. Okay, so three, there are only four answered. Okay, so maybe one will be counted manually later. They are okay, so which means, okay, from the four groups who answered here, three got it correct. Congratulations. That's question number 3. Moving to question number 4.
Next. Which of the following is an example of nursing malpractice? Which of the following is an example of nursing malpractice? Is it A, or is it on the red? The nurse administered penicillin to a patient with a documented history of allergy to the drug. The patient experiences an allergic reaction and a cerebral damage resulting from anoxia. Or is it the nurse applies in the blue, applies a hot water bottle or a heating pad to the abdomen of a patient with abdominal cramping? The nurse assists a patient out of bed with the bed locked in position. The patient slips and fractures his right humerus. For the last choice, which is on the green box, the nurse administers the wrong medication to a patient and the patient vomits. This information is documented and reported to the physician and the nursing supervisor. Let's start answering now the question. Which of the following is an example of nursing malpractice? The nurse administered penicillin to a patient with documented history of allergy to the drug. The patient experiences an allergic reaction and a cerebral damage resulting from anoxia. The nurse applies a hot water bottle or a heating pad to the abdomen of a patient with abdominal cramping. The nurse assists a patient out of bed with the bed locked in position. The patient slips and fractures his right humerus. Or the last, the nurse administers the wrong medication to a patient and the patient vomits. This information is documented and reported to the physician and the nursing supervisor. Okay, so the answer is okay on the red. The three elements necessary to establish a nursing malpractice are nursing error, administering penicillin to a patient with documented allergy to the drug, injury, cerebral damage, and proximal cause, administering penicillin causes the cerebral damage, applying a hot water bottle or heating pad to a patient without the physician's order does not include the three required components. Assisting a patient out of bed with the bed locked in position is the correct nursing practice. Therefore, the fracture was not the result of malpractice. Administering an incorrect medication is a nursing error. However, if such action resulted in serious illness or chronic problem, the nurse could be sued for malpractice. Okay, we got it correct. Congratulations. Question number 5. A male patient who had a surgery 2 days ago for head and neck cancer is about to make his first attempt to ambulate outside his room. The nurse notes that he is steady on his feet and that his vision was unaffected by the surgery. Which of the following nursing interventions would be appropriate? Is it encourage the patient to walk in the hall alone? Or is it discourage the patient from walking in the hall for a few more days? Accompany the patient for his walk? Or consult a physical therapist before allowing the patient to ambulate? You can now start answering the question. Less than 20 seconds to answer the question. Less than 10 seconds. Okay, so they have different answers. So the answer is accompanied the patient for his walk. Okay, a hospitalized surgical patient leaving his room for the first time fears rejection and others staring at him, so he should not walk alone. Accompanying him will offer moral support, enabling him to face the rest of the world. Patients should begin ambulation as soon as possible after surgery to decrease complications and to regain strength and confidence. Waiting to consult a physical therapist is unnecessary. Congratulations to the two groups who got it correct because we have right now five answers. Three got it incorrect, two groups got it correct. Next question, question number 6. Okay, so let's go now with the research. The nurse researcher investigated on the effect of green tea extract in weight reduction in patients with obesity. He gathered four groups and named them as a group L, M, N, and O group. Prior assessment was given to groups L and M. The green tea extract was given to group L and N, and they took it every 6 p.m. for 2 weeks' time. And groups M and O are advised to drink only water every 6 p.m. for 2 weeks. Post assessment was done to all groups after the time duration of the study. The question is, what is the research design category used in the study? Is it Solomon Four Groups Design? Is it Salome Four Groups Design? Is it Qualitative Research Design or Quantitative Research Design? The nurse researcher investigated on the effect of green tea extract in weight reduction in patients with obesity. He gathered four groups and named them as Group L, M, and O group. Prior assessment was given to groups L and M. The green tea extract was given to group L and N, and they took it every 6 p.m. for 2 weeks' time. And groups M and O are advised to drink only water every 6 p.m. for 2 weeks. Post assessment was done to all groups after the time duration of the study. What is the research design category used in the study? So if you listen very well during your lecture with Dr. Cyrus Tupal, you will get the answer easily. Okay, so from the four groups who answered it, maybe one, okay, will just be counted manually later. So the answer is Solomon Four Groups Design. Correct? Okay, so that is question number 6. Let's move on to question number 7. Okay, question number 7. The barangay survivor has a population of 10,000 as of July 1, 2018. As per calendar year 2018, a total of 150 deaths were recorded. 100 from diseases, which 55 are under 12 months of age, and 45 are under 28 days of age out of the 700 registered total live births of the same year. While 20 died due to vehicular and work-related accidents, 5 are from crimes and 25 related to childbirth. While out of 120 farmers, total number of deaths are 25 and 10 died due to snake bite. 5 of them are women and who died also from snake bite. The question is, which of the following formula should be used to compute crude death rate? In the red, 45 over 700 times 1000.
150 over 10,000 times 1,000, or is it 20,000 20, sorry, 20 over 10,000 times 1,000, or in the green box, 10 divided by 120 times 100,000. The barangay survivors a population of 10,000 of July 1, 2018. As per calendar year 2018, a total of 150 deaths were recorded, 100 from diseases, which 55 were under 12 months of age and 45 were under 28 days of age, out of the 700 registered total live births of the same year, while 20 died due to vehicular accidents. Okay, there are 5 from crimes and 95 related to childbirth. Which of the following formulas should be used to compute crude death rate? Okay, so the answer is there are 150 deaths, so that is total number of deaths, and you have to divide it with the population, which is 10,000, then multiply it with 1,000. So the answer is in the blue box. Okay, from the 4 groups that we have here, only one got it correct. Okay, let's move to the question number 8. A man driving his motorcycle slides but manages to go to the hospital for treatment. He suffers minor abrasions and contusions. The attending nurse applies hydrogen peroxide and 10% solution of betadine to the injured bodily areas along with other medications. The application of antisepsis is painful. Now, the patient experiences pain out of the said healthcare interventions. It is morally permissible under paternalism, double effect, beneficence, non-maleficence. A man driving his motorcycle slides but manages to go to the hospital for treatment. He suffers minor abrasions and contusions. The attending nurse applies hydrogen peroxide and 10% solution of betadine to the injured bodily areas along with other medications. The application of antiseptics is painful. Now, the patient experiences pain out of the said healthcare intervention. This is morally permissible under paternalism, double effect, beneficence, or non-maleficence. Let's Okay, so the answer is double effect. Very good for the 3 groups. Don't worry, 2 groups. We still have 2 questions left. Okay, so there are 3 groups who answered correctly and 2 groups got it incorrect. Okay, that's so nice. Okay, let's go on to the second to the last question in the difficult round. Team Orem now is the highest. Okay, so the second and last question. The researcher who will study the dietary practices of ramp models and beauty queens, just like SIR2, who need to maintain a certain weight and would utilize which type of research? Experimental research, non-experimental research, phenomenology, or ethnography. The researcher who will study the dietary practices of ramp models and beauty queens like SIR2, who need to maintain a certain weight, would utilize which type of research? Is it experimental, non-experimental, phenomenology, or ethnography? groups already answered it. Still have 20 seconds. Okay, the answer is ethnography. Wow, from the five groups, only one group got it correct. Okay, last question for the difficult round. Whoops, Team RM is on top, but that is not the final score. Last question. The nurse is educating a client who's at risk for coronary artery disease. The nurse tells the client that CAD has many risk factors. Risk factors that can be controlled or modified include gender, obesity, family history, and smoking. Or is it inactivity, stress, gender, and smoking? Or is it obesity, inactivity, diet, and smoking? Or is it stress, family, and obesity? Good luck, guys. This is the last question. There are only one group. Okay, we're still waiting. You still have time to think for the answer. Good luck, guys. Okay, Mr. Kimson, I love you, Jean Watson. Okay, that will be sent to Dr. Jean Watson in the US. Don't worry. Go Team Roy, habol lang. Okay, we still have 37 seconds. Think. Okay, I'm reading now your chat here in YouTube. Go Watson, go Sir Ron, no async. Hahaha, Mr. Dizon. No synchronous ka dyan. Okay. Oh, so from this question, all groups got it correct. The answer is obesity, inactivity, diet, and smoking. They're all controllable and can be modified. So that's it for this quiz B. Okay, so from Ma'am Joy Alarca, shout out sa mga group Peplao. Okay, but this is not yet the final tally. Okay, so number one here from the difficult round is Team Orem. Oh, nakahabol ang Team Orem. Oh, imagine 7 out of 10. But we still have to finalize all your scores from easy, moderate, and difficult round. Okay, so let's go now with our YouTube channel. Okay, for the last time before I give it back to Miss Crystal, our very, very beautiful and very energetic host for the entire Nurses Week. Okay, so we have here, okay, any message? Go, Sir Ron. No, async. Ulit-ulit, Mr. Dizon, ha? Okay, bawi next time. Next year. Yeah, based from Mr. Kinson. Okay, Team Plau all the way from Mr. Dizon. Okay. Yep. Let's go Team Leninger from Miss Nelias. Don't forget to like and share. Like, share, and subscribe. Okay. Ralph Cruzin, pa-shoutout kay Christine Hunyo. Shoutout Miss Hunyo. Miss Dedica, ilang-ilang love you, Team Watson. Heart, heart, heart. Okay, who else? Any shout out there, guys, from the BSN? This is your time now to share. Oh, Miss Kate Viray, Sir Ron, pa-shout out, BSN 4A. Woohoo! Okay, Miss Molvizar, go, Orem. Okay, shout out to Rain Ramiro, Team Orem from Miss Sanchez. From Mr. Dizon, congratulations everyone. Okay, from Miss Lalasas. Okay, shout out to BSN1. From Miss Nika Chan, shout out to BSN4. Kate Riser, ulitin mo po ulit. Mika Chan, congrats Orem, nakahabol. Okay, shout out to Rain Ramiro from Miss Sanchez. Green heart, heart, heart. Okay, from Miss, from Pauline Faith, heart, heart, heart. Red heart, heart, heart. Miss Diane Sanchez, shout to Rain Ramiro. And shout out to Malinis from Orem, from CC Patao. From Mr. Kimson, shout out sa lahat ng team. Nice game. Woohoo! Okay, so that ends our Battle of the Theorists. So I'll give it back now to your host, Miss Kistel Miguel. Thank you, guys.
So, all right, there you have it on our nursing quiz bee battle of theories. Wow. So later this afternoon, we will find out, or no, rather, we will extend first our finalization for the winners of our quiz bee, since this earlier this morning we were encountering some difficulties with some of our teams. So we will give away for our panels to for the tallies of the scores of the final scores of the winners for this nursing quiz bee battle of theories. So what a set of questions, right? We got over here. All right.
Yes.
So we want to thank all the participants of this nursing quiz bee, and also to the clinical instructors who guide our participants, our students, this morning. So I know you guys are feeling hungry right now, so we would like to give our time for our break time, and then we'll get back to you guys for some more activities that we prepared for you this afternoon. So I hope you guys will be participating again for our program this afternoon on the continuation of the celebration of our Nurses and Caregivers Week 2020. So see you guys later again. Have a happy lunch. Thank you.
Thank you, guys. Love, love, love.